Hello, my name is Erica Smelser, and I am a student in the RN to BSN online program at UCCI University. I have chosen to do my senior practicum on improving the driveway report call process as a home health nurse. What is a driveway report call? It's a communication tool that we use when we are communicating information from our patient admissions to another clinical team member, such as our clinical manager. Home health is when a patient who is stable enough to be home, but still needs skilled health services while at home, can have care by a nurse at home. For example, a patient who has recently had surgery and is taking opioids for pain and is unable to drive due to safety standards from opioid use and may still need wound care. As a nurse, we have a big role in the admission process for the patient. We have to learn and identify patient safety, their current status, and their needs. We have to identify if their ambulation status, such as a fall risk, is in need of a referral for therapy for their safety. The nurse completes an assessment and documents this visit. After the visit, the nurse gathers this information and relays it by phone to the clinical manager. Here's a copy of the tool I created to simplify the process of the nursing driveway report call. The reason I created it this way is to have a standardized format for the CAR for all nursing clinicians. Though I was unable to find peer-reviewed studies on a driveway report call process or tools used for it, I did find studies related to a nursing communication tool known as the SBAR and the importance of communication between clinical team members. The article titled Communication During Transition of Care 2024 discusses how lack of communication or miscommunication can be detrimental to a patient's health and outcome. It states how the lack of teamwork or incorrect, ill-timed communication is the main cause of adverse health events with patients, medication errors, and rehospitalization. The article of Martinez Fernandez et al. 2022 describes how important the situation, background, assessment, and recommendation tool, also known as the SBAR, is in successful patient communication. The study states that the handoff process from one healthcare setting to another is one of the most critical moments of the communication process. Having all clinicians unified in the way we deliver our admission, patient information, and needs will help us to regulate the information coming in. By doing this, the clinical manager will be assured she will have always be able to get the information on the driveway report call. Having a copy of this format, the clinical manager will be able to follow along and know what to expect. When things like a physical therapy skill is needed, we should be able to, as nurses, be able to identify that and be able to communicate it to our clinical manager so she's able to get an immediate referral in and be able to schedule a patient with that first therapy consult by the next day. Ultimately, this tool will be used to ensure all nursing information is given so that we can meet the patient goals and needs. After getting permission from my mentor, who is also my clinical manager, we initiated a mandatory meeting through email to take place after our weekly meeting. I educated the team on how I felt there is a need for a standardized tool for our driveway report calls. I handed out copies for them to review and follow along. I explained the importance of clinician-to-clinician team communication in relation to patient safety. I went over the benefits and the goals. At the end, I gave a quiz to see if they were able to retain the information they were given. Out of all 9 clinicians, only 2 people missed a question on their quiz. I then held time for them to have a discussion, have input from each of them on their thoughts, critiques, and added ideas and questions. The engagement was a success, and we determined as a group we would move forward with its trial use. I have strategies to start to finish for this program in order to complete it successfully. I met with my mentor and I established approval to do the mentorship with her and to come up with a project idea. Once that was done, we reviewed and studied peer-reviewed articles that I found and decided how to use that information to create a driveway report call sheet. My mentor did review my first draft and any added drafts after that when we made changes after getting opinions and feedback from my nursing team. We were able to complete a draft and gain approval for the final draft from my director. Once I had that permission, I got permission for an in-service for my clinical team in order to provide education and training on the driveway report call sheet. I hosted an in-service and completed education, training, and gained feedback. I followed up with the team's experience with a survey, and I also followed up with them day to day through email and conversations in person when in the meetings in the office to see how their status was going using this new tool. The overall feedback each time was that everybody found that it was helpful and helped them organize their information. I then met with my mentor and discussed the results and the progress and the options of changes and using it moving forward. Survey results were 100% satisfaction because it was easy to understand, easy to use, the organization of it, and they decided at the end of the survey that they wanted to continue using it for a longer trial. My mentor and my director stated that they appreciated how it regulates how much patient information is coming in. Because of the organized format, they know exactly how to follow along and what to expect from the top to the bottom of what the clinician should be giving them. It also helps them to save time with the team calls and helps the clinicians to remember important information so they don't have to repeat calls and call back later with more information they forgot prior. Because of this, we've decided to lengthen the trial of use and discuss its permanent use. Make connections in this process with my team. I normally saw them few and far in between, only in meetings, because as a home health nurse, we work independently in the field and see each other about 4 times at max in the office for meetings. This process gained me insight on how to value their teamwork that I have gained with working on this with them. And it also showed them that I valued their opinions by asking for their advice and feedback. I obviously did not have very much confidence in the beginning of creating this project for my team as a in-service educator. It was my first time in that role with them. After completing it, I felt confident, and now I feel I can move forward with more confidence in my next training session. My experience of making a quality improvement project has made it where now I know somewhat what to expect moving forward in another one, and I look forward to creating another one. Some opportunities that I've gained as a result is the continued use of my driveway report call sheet until the end of November, where we're going to decide if we want to continue its use permanently. And I have also met with my director, and she wants to bring me on her next quality control project that she's doing so I can learn it from a director's point of view. Here are my references that I mentioned prior for my research study. Thank you for joining me today. I hope you have enjoyed it, and reach out if you have any questions. Thank you.